Hey guys, welcome to another Lifestyle of Eden podcast. My name is Nick Tognetti, and today I have a very special guest for many reasons, Dr. Vic Rajan. Dr. Rajan, thank you for joining us today.
Thank you for having me.
So, I'll give a little bit of insight and then I want Dr. Rajan to be able to share his own insight. But I recently came across Dr. Rajan. I've been very, very interested in kidneys for years. I have certain relatives in my family that have had kidney issues. And so it's always been a passionate topic of mine. Well, about a month and a half ago, I ran into Dr. Rajan, got to learn a little bit from him. We got to share some back and forth stuffs, exchanged each other's numbers. And now, what we've actually done, which I think is going to be a great partnership, is we have signed a contract where Dr. Rajan is now the consultant for Lifestyle of Eden. For all of my toughest cases, I bring these things to him. We look at them over together. We discuss different things. And the insights that he brings me is simply priceless. And I think, especially in the functional space, anybody who's really deep in the functional space, I think will thoroughly agree with this, is the functional space is really doctor deficient. And it's very nurse practitioner filled, which I love nurse practitioners. I'm very close with many of them. But the reason being, too, which I'll let Dr. Rajan explain, is because the functional space is about root causes. We're not just about throwing people on medication. And if we do use medication, it's more band-aid based while we deal with the root, then pull you off. And so without further ado, Dr. Rajan is a nephrologist. He's an MD and board certified in nephrology, um, internal medicine, pediatrics, and integrative medicine. So, Dr. Rajan, thank you for joining us. And why don't you just share a little bit about your background, what you really specialize in, talk about your holistic nutrition, getting people off medications, just kind of your whole concept.
Yes, thank you. So, as I am bordered in all those areas, and part time, I practice emergency medicine as well, and then the other part of the time I do integrative medicine. And integrative medicine is basically the combination of conventional medicine and alternative medicine, like functional medicine, nutritional medicine, basically looking at things other than pills or pharmaceutical pills and medical procedures. Because um, when it comes to our traditional system, it is heavily dependent on pharmaceuticals and medical procedures. It's pretty much all they got. And it's unfortunate because when it comes to chronic disease, we did not evolve to have a deficiency of Lipitor and metformin in our diet or the need for a cardiac cath or spine surgery in our lifestyle. But we did end up having problems with our diet and lifestyle in what I call an algorithm of six. Six common causes of chronic disease, which is issues with nutrition, exercise, sleep, stress management, isolation, environmental toxicity. These are the six things. If any one of these things are deficient, and in many people, more than one thing
Yeah.
that's off, then some chronic disease will develop. Now, you go to a traditional doctor, they will basically figure out what disease you have so they can figure out what pharmaceuticals or what procedures, what consultants you need for that. But it doesn't actually fix the disease. It would be uh, it would be kind of like, imagine if you had, say, a bacterial pneumonia, right? Now, treatment for bacterial infections is antibiotics. That is standard. But imagine if you just went to the doctor and they didn't have antibiotics, or they didn't even bother to talk about it. They said, "We'll give you some cough suppressant. We'll give you some Tylenol and decongestant. That's it,
Right,
right?"
right.
Your symptoms might feel a little better, but you will still continue to progress with your
You didn't
infection
fix the root. Yeah.
because you didn't get to the root cause. Well, in this case, with most chronic disease, it's not necessarily infection. It is, again, that algorithm of six. But no one takes the time to deal with that. And for several reasons. One, it is very time intensive to do so.
Yeah.
And the way insurance based medical practices work, they're short on time.
Yeah,
Uh,
right.
Appointments are typically 15 minutes long, half of which is used on electronic patient records. And so the doctor's only talking to you for maybe 5 minutes, if even that. Or maybe the doctor isn't even talking to you because they're all getting replaced by nurse practitioners on an outpatient basis. So the only time you may see a doctor is either you're paying for concierge medicine, or there's a procedure involved. Concierge medicine, you see some of that, and that's basically, paying out of pocket like a annual fee to a doctor to get more time, and you do get more time, but the problem is more time with the doctor to learn more about medical pills, procedures, because it's still conventional medicine when it comes to
Right.
concierge, and it just doesn't solve the problem. So my thing is what I call my practice concierge integrative medicine, looking at the algorithm of six as the first approach to try and figure out how to solve chronic disease. And to the extent that patients do that, they can get off pills or and avoid procedures and get a lot better. Now, at the same time, as a doctor, you have access to testing, you have access to prescription drugs if there's a severe exacerbation. If there's a medical emergency, I can identify that and tell them, hey, you need to go to an emergency room. Because, for example, I say this as a joke, but it's true. If you're having chest pain, you might have a heart attack. Don't go to the naturopath for some herbs and spices.
Yeah.
Go to the emergency room.
Yeah.
You see a cardiologist. Get a cardiac cath if you're having a heart attack. And then, after all that's said and done, you can talk to a functional medicine specialist about what caused the heart attack in the first
How
place.
to prevent it from happening again.
And because it's not just cholesterol,
Right.
a lot of it is
Inflammation,
inflammation.
CRPs, and
Yep,
all that. Yeah.
inflammation,
Right, right.
and that is something that our system does not address very well.
Well, they don't test those things in typical blood panels. Like CRPs, a lot of people that come to me with their blood panels, they don't have CRPs tested. They don't have reverse T3 tested. They don't have thyroid peroxidase tested. So you may have an autoimmune disease like Hashimoto's, but you'll never know because that can only really be diagnosed through TPOAB, and that's not even on these, general testings. Like, I know somebody just the other day, they came to me and showed me their blood work and the glucose was through the roof. And I asked them, I said, "What's the A1C?" And they go, "Oh, that's not on my blood work." And I'm like, "What do you mean it's not on your blood work? That's like that's how you diagnose diabetes." So
Yeah,
all these different things. But that's one of the reasons why essentially why I hired you to be, on the payroll and within our practice as the consultant and everything is because, when it comes to being a doctor, the big reason in my space, and I feel that I represent the functional space, pretty well, and I hope to be a good representation of that, is when it comes to doctors. I'll give you the example. I met with two nephrologists in 1 week. I was speaking with you, and I spoke with another nephrologist, and I shared the concept of low dose rapamycin. Y'all both practice nephrology. You both know what rapamycin is, or also known as sirolimus, right? And it's an anti-transplant rejection drug in high doses. So when somebody gets a kidney transplant, so the immune system doesn't go crazy, give them rapamycin so it receives the transplant. But in low doses, it's being used. It's not only being used radically, it's being studied radically in tons of literature on the fact that it's being used for anti-aging and autophagy. Well, the thing is, neither of you two were aware of that. But the difference between you two was he just threw me out, basically flicked the wrist at me, and you said, "Man, that's really interesting." And you studied up on it. You go, "Hey, no, there are serious studies being put out about this." And that was really what caught my attention with you, where I go, the other doctor, that's the reason why people in my space don't trust them, is they're, number one, they're all about prescriptions.
yeah,
And if they what they learned 30 years ago was all they've learned, and they don't want to continue learning, where medicine and nutrition is continually evolving in
yeah,
the revelations of it. And so the humble learning of it, and then how much knowledge obviously you pour into me and really look out for me and for my clients, but how you specialize also in getting people off of medication. You don't want people on it. You want people to be able to have, like I think on your website it even says helping people heal
yep,
themselves. I think it's even on your door.
yes, it is.
And so, the two of the areas that I do really want to bring up, we'll get to the nephrology and kidney part here in a little bit because I think it's worthy of conversation given that 1 in 7 US adults have chronic kidney disease without knowing. And but before we get into that, I want to talk about one of your pillars of six. One of them is isolation, which also can just simply be, we can say isolation or lack of community, or in other words, just environment. And so I thought that this was incredible that you had this in there, and the reason being is that I'm really big on studying the blue zones. I was going to, I paid for an apartment in Greece to go study Icaria, Greece, one of the 5 blue zones in the world. And there was this amazing story on the blue zones. It's episode 4 on Netflix, And there was a man who lived in Greece when he was around my age or a little younger. I'm 30 now. Whenever he was a little younger than me, he decided, I want to go to America. I want to, find a wife. I want to have the American dream, build a successful business, blah, blah, blah. So he comes to America, builds this incredibly successful business, becomes very wealthy, and at 65 years old, by three different doctors, he was diagnosed with terminal lung cancer with 6 months to live. And so he told his wife, we basically have a choice. I'm dying in 6 months. So the question just becomes, where do I want to die? And so he had decided, I don't really want to die in the US. I'd rather die in Greece. So they moved back to Greece. He doesn't change anything. He takes no medication. He doesn't change his diet. All he did was change his environment and his community, and just like the joy of not being under the American dream stress of needing to compete and get money. And he just was able to just go enjoy himself over there. And he planted a vineyard, and he said, I'm not going to be able to pick these grapes because I'll be dead, but my wife will. And when she does, she'll think of me. Well, sure enough, 6 months later, he's alive. A year later, 2 years, 3 years, 37 years go by, and he's 102 years old, still running around, growing his vineyard. And they asked him, they go, what happened? And he goes, I don't know. I guess I just forgot to die. And so he goes, no, but seriously though, I didn't change anything. I just changed my environment.
Yeah.
I was no longer under the stress, the inflammation, stress is such a number one killer that we see all the time and all these different things. So number one, how did you come to the revelation of, me and you have talked about, like, even in your personal life, you can easily like isolate yourself. Me and you kind of have that in common, which I know is a shortcoming of mine that I'm working on. But how did you come to that revelation, and how important is that whole concept of needing community, needing a better environment, reducing your stress, all that whole nine?
Well, I came to that personal revelation through personal trauma. When I was in residency, my dad passed away.
Which residency is after you graduate? Now
After graduating medical school, yes. So this was in 2003.
Okay.
And so, yeah, at that time, he was driving on his way to see me. I talked to him before and said, hey, I'll see you in a few hours. And, so I was post call, and this is on the pediatric oncology unit. And at that time, just going through our rounds and seeing the patients. And the last patient of the day was this teenager. She was recovering from cancer. She was doing pretty well. And she just, for whatever reason, I know the reason now, but at that time, she just started going into a conversation with God and the Spirit and the things we can control, the things we can't control. And just by the end of this conversation, she's like, do you want to pray with me?
Wow. Oh, wow.
That's only happened to me twice in my entire medical career. And so, and I think that was the first time. So I said, sure, why not? So we hold hands, and me, patient, my medical student who was following me. And so I'll pray, understand God, the Spirit, and, Jesus Christ's name, amen. And I tell her, I'm glad you feel that spirituality, presence of God in your life, because, you're going through cancer. You need that strength to be able to get through it. And 15 minutes later, I get a page, unknown number. I call it, and it's some from hospital in mid Louisiana saying, found your dad was in a car accident. His car turned over. He came in with head injuries. I'm sorry, he didn't make it.
Wow.
And so that was, my dad was a very spiritual person. He felt like God in the Spirit, and I understood it contextually, intellectually, but feeling it at the same level, I wasn't able to feel that at the same level. I understood it.
Yeah.
I couldn't. When that happened, then it changed. I could feel it, but it was also, and I realized that that conversation was meant for me.
Come on.
And so, but now how that gets into isolation? Well, so I lost my dad. My mom, she was sick to begin with. She had
IgA nephropathy, right?
She had 2 transplants, but transplants don't last forever. They last on average 5 to 10 years. So she had the second transplant failure. She was on dialysis. She couldn't get another transplant because she had hepatitis C from blood
I didn't
transfusions.
realize transplants don't last that long. Okay.
No, they don't.
Is
'Cause
that just kidneys or
mm,
what, like liver too? And
it could be others too, but
okay,
kidney
gotcha.
specifically, that yeah,
5 to 10
5 to 10
years.
years because usually chronic rejection.
Gotcha.
And
Okay.
so
Okay. Anyway, go
in
on.
any case, she was so she couldn't get another transplant because she had Hep C from contracted from blood transfusions in the 1980s.
Wow.
Now she was having, cirrhosis of the liver,
Wow.
and so she didn't qualify for a transplant, and had now she was living in Houston, and her health was declining. I was in New Orleans, have no siblings, she has no family. She just lost my dad now, so now she's depressed, and doesn't doesn't talk to when someone's depressed and sort of like angry and upset, it's hard to talk, and I'm doing this. I'm doing my residency in New Orleans, and at that time too, my personality was kind of more quiet, just studious, just get to work. I had like one friend who was more socially awkward than I was, and I'm looking at my life. Dad died. It's hard to talk to her. I have no siblings, and like my life kind of sucks right now,
Mm.
and didn't know what to do. Now I was home when just visiting my mom, and I saw this on TV. Uh, the comedian his name is Ken Jeong. He's the Asian comedian. You see him in like The Voice, one of the judges, but he's actually a physician trained in New Orleans. Did stand up comedy 10 years before I did, and I saw him on BET, and he was the funniest guy that night. And I once did stand up comedy when I was in middle school.
Oh wow.
It was like long story with that, but I did it for like a couple of months. Then we ended up moving to Indonesia, and no one understood the jokes. It
Yeah.
was Indonesia, so
Wow.
and in any case, so I stopped doing that, but I saw this guy on TV, and he was hilarious, and I thought, wow, so it can be done, and even when you're a doctor. So I went out there and reached out. Uh, I went to the stage. I did it. I went open mic, um, and I actually did well. And when you're in comedy, that is a very social
Environment.
environment,
Yeah.
and you're reaching out to people through your jokes, and of course on stage the audience reaches back through their laughter, but also even afterwards, you having it set, people reach out to you afterwards, and that was one of the things where I realized, for me, I didn't know I had depression at the time, but
You don't
I was
know
going.
until you get into one of those happy environments how really off you are.
Yeah, well, but I was going through it, and that was my way of coping through it. And we say laughter is the best medicine, right?
Amen.
I mean, it's cheaper than Prozac.
Even the Bible says in Proverbs 17:22, Lev Sameach etiv Gea. It says that a glad or rejoicing heart is a good cure or is good healing. So it says that right there. That is laughter is good medicine. That is a genuine thing right from the scripture. That has been really heavy on me lately.
Yeah,
Is that exact verse, and just being in isolation, you don't get whether even if you're not depressed, you're still not getting all the laughter. You're still not getting all the gladness, all the joy, and all those different things. So keep
yeah.
going.
So the friends I made from the comedy circuit, and just and the people I met, that was what kept me going, and be able to continue. And it taught me it taught me one thing. It's like you have to reach out to people for people to reach back to you.
And not only the isolation aspect, but me and you have talked about too, is just the environment, in the sense of you could be in the midst of a really bad relationship, or really bad friendship, or a really bad job. I've literally watched people. I have a client actually that just signed up with me. She had crucifying gut issues. She literally she was dating this guy, got out of that relationship, and her gut completely healed. And I've seen this over and over and over again, where people have somehow gotten out of their environment. In fact, I always tell people, when it comes to my practice, when I'm dealing with Hashimoto's, which is obviously an autoimmune thyroid, when I'm dealing with gut cases, all these different things, the number one dictator of the people that just, I mean, I'll have people that on their gut protocols, they'll be 7 days in and be like, Nick, I'm feeling incredible. The number one dictator between the people that genuinely get fully reversed in results and this, that, and the other, and those who don't, is obviously you just simply just have to follow what I write. But it has to do with their stress levels and their
Yes.
environment.
Yes.
That is the number one dictator that I've actually watched.
Yep. In fact, there's this. I was at a allergy conference, and it was several years back, and there was a story of a physician who talked about one patient he had intractable eczema. It tried everything, all the medications, couldn't couldn't shake it off, right? And eventually, the patient was lost to follow-up for a while. Came back a couple of years later, saw the physician again. Eczema was cleared up.
Wow.
And he said, "Oh, that's great." It's like, what did he do? She's like, "I got a divorce and moved to Colorado, Rocky Mountain High."
Oh my God.
And so I was like, that was the issue. She was in a toxic relationship, and she needed a change of venue. Environmental toxicity. It's not necessarily bad food or air or water. It could be, the people around you. So she needed to move, and that it changed everything. And so, because stress drives inflammation.
Well, think about it like this. Even with my Hashi's cases, obviously every autoimmune disease on the earth has a leaky gut component, but the thing that either drives or exacerbates or will actually cause these things to come out of remission, I always see as the stress. And so even, let's use me as an example. Like I have never in my life ever have I ever had TPO AB antibodies, thyroid peroxidase antibodies, ever present on my blood work. And my uncle just passed, and then now I'm moving across the country in 2 days, and I've had just tormenting amounts of stress on me. And sure enough, last week I got my blood work done. I had a present TPO AB on my blood work. And I was just sitting there and I go, this is nothing other than just the radical stress I've been under. Now, granted, I don't do well with gluten either, so I added that in. But, the stress, absolutely. So I see it even in myself. I see it with different things all the time. Could be gut components, could be now like I said, I was totally shocked when I had that because I go, man, maybe I have a genetic disposition to these things, but this just, was able to kind of express itself through this stress. I never knew I even had a genetic disposition because I've never had, those levels climb, but that's why, like I said, your pillar of six, that one really, the other ones seem to kind of be a little bit more obvious, I think, to a lot of people, like nutrition. Okay, that's an obvious one, right? But when it comes to that isolation aspect or that environmental factor, in fact, I have a client in another state right now, and when she came to me, her gut wasn't like that bad. Like all she had was low good bacteria. So that's simple. You just let's feed it up. Yeah. And she didn't have SIBO, she didn't have H. pylori, she didn't have any of that stuff. Well, over the last 12 weeks, I ended up getting another blood work. Her blood work is worse, and her issues are way through the roof. And me and her got to have a private conversation, and the stuff going on at home is so tormentingly stressful. And I told her, I said, hey, listen, like we've got to figure out how to manage this stress. I'm not telling you to do this or to do that. I'm just saying that this is an issue, and we've got to learn how to manage it better. Because I'm watching it in your blood. Look at the side by sides. You are literally, this is killing you on a physical level. How much more so spiritual, mental, everything else. So I can greatly appreciate it. I think it's an awesome aspect that you bring to the table from a scientific basis, from a testimonial basis in your own life. And then also, like I said, you using herbs and nutrition and different things to get people off of medications. Like, me and you were just talking about a client when it came to high prostate. And so discussing and high estrogen, instead of discussing these prescriptions, hey, let's talk about DIM, let's talk about calcium glucarate, let's talk about milk thistle, let's talk about these different types of things. That is really the game changer because we're attacking root causes.
I call it nutraceutical therapy.
Nutraceutical,
therapy with nutritional supplements or herbals. The thing about that is that it's less side effects than your pharmaceuticals, and for mild to moderate disease, it actually can work if you're familiar with it enough to know how to dose it. You have the proper brands, because not all the brands that people and consumers get in like the vitamin shops and stuff are good quality,
Right.
or even have the proper dosage. And so you need functional practitioners, whether it be functional nutritionists or functional medicine docs, integrative,
Right.
who are familiar with these things to help manage that and use it for, it's like therapeutic purposes. And I've seen it work. I've taken it for myself for various conditions, and done so for my patients. And so it is it is it is a good thing to utilize instead of prescription drugs. Having said that, supplements are called supplements for a reason. They are not replacements
Yeah, they're
for
not.
the algorithm of six, which is
Yeah.
your diet. You can't fix grams of pounds of toxic food
Yeah.
with milligrams
Diet
of
lifestyle is
pills.
the pinnacle. It's like me and you were talking about the other day. You can't, like, when it comes to the gut issues, I can't out diet a stressed life. Like,
Yeah.
you have to fix the foundational roots.
Oh yes, and the stress is the big thing. In fact, I think
And you can't out supplement a bad diet, like you were
yeah,
saying. Yeah.
yep. In fact, I think a big component of functional medicine is not just the nutrition part. I think also almost like mental health, like life coaching,
For sure.
because that's another thing too. You don't see it. You certainly don't see it in psychiatry. Psychiatry will be like, well, let's put you on some Lexapro or some Prozac or something, and that's not going to fix the problem.
Right.
You have to dive into their life, and how you can help them either fix the stressor, or if you can't fix the stressor, learn how to cope with it.
And that's one of the things too. Me and you discussed this, where me, I'm very big into mental health, especially having ASD and everything else. But being a pastor, I deal with this a lot in my practice, where people, I mean, my phone, for not just one or two or three, for dozens and dozens of my clients, I always tell them, use my phone as a diary. I go, if you have issues, I go, I may not even text back, but my phone is a place for you to express yourself, for you to just get it out. And a lot of times when I notice, because I just noticed this with me, is my mentors taught me sometimes they just let me vent and they will not respond to me for like 3 or 4 days. And the reason being is because they know that during that 2 or 3 or 4 days, I'm going to come to the right conclusion. I just needed an outlet to be
Yeah.
able to vent with different things. And that's what I do with a lot of my clients, where I'll leave for like 2 or 3 or 4 days and then I'll come back and respond, because I go, they needed that time. I want them to be able to vent to me, but I also want them to be able to process it and this, that, and the other. And I have multiple clients that are therapists,
Yeah.
and I'm actually, just how we have you as a doctor, as an MD, for all of my clients nationwide for consulting. One of the things that I have discussed with one of the therapists in my practice is, hey, I am looking at potentially having a therapist in my practice to be able to send my clients to, whether it's in Texas. If it's out of the state, then you figuring out how, even maybe offline, you get
Yes.
to kind of communicate with them or whatever, because I just see it's so important in my practice, where I've had multiple cases where they end up getting fixed up, but it takes a lot longer than it needed to, and it's just because the stress in their life, managing certain mental health components. Like I said, I'm big on mental health because I've struggled with depression. I've struggled with all those things. My ASD at different points in my life, through whether it's bad nutrition or just certain life circumstances, has been exacerbated in different things. So I can relate to it for sure. But the other part that I really want to spin to, just because it's mind blowing to me how prevalent it is right now, is your profession, specifically in nephrology, which, for those who don't know, nephrology is kidney specialist, the study of the kidneys, right? And so, like, nephrotoxicity is kidney toxicity. So if we say that, then you know what we're talking about here. But it blew my mind that 1 in 7 adults in the United States have CKD, stage 1 through stage 5, whichever one it is. They have CKD, chronic kidney disease. Many more probably have AKI, acute kidney injury, and they don't even know it. And I had one person come to me. Well, and actually, first, before I say that, I'll preface it with this. I recently had gone through a severe kidney stress, right? And that's where you kind of helped, chimed in and really started working with me and helping me out with all of that. And every issue that I've ever had, God has used it. Like my gut issues in the past, God ended up using it to where now that's what I do, is help people with the gut. Thyroid, that's what I do, is help people with the thyroid. All these different things, right? Well, now the Lord's bringing me a flood of liver and a flood of kidney. And I have a client he came to me, and initially he came to me because he goes, "Hey, I have GERD and he's got Parkinson's." And he said, "I really want my GERD reversed. And Parkinson's, I know it's going to be an uphill battle, but I really want to get this kind of thing under control, with lifestyle, with diet, with cleansing out toxic heavy metals, and, you know, really kind of helping you to fix up and clean out neurotransmitters and all those different things that have to do with Parkinson's." Well, when he came to me and he gave me his blood work, I'm sharing with he on his and his wife on the consultation call. I said, "Hey, did you know that your kidneys are like really stressed out? Like they're not good right now. This is actually pretty bad." He goes, "No." He goes, "My doctor's never said anything." And I go, "Okay, are you aware that you're a type 2 diabetic?" And he goes, "No, I've had no idea about that." He goes, "My doctor has never told me any of these things." And so he's a prime example, but I get this literally almost every week now where people have these things and they don't even know. And so let's start this, because this is one of the number one questions I get asked. And now, me and you have had these discussions so many times, but what are the top reasons in the United States for CKD or chronic kidney disease, or, kidney, struggles and trouble in that regard? What are the top reasons?
Top two are going to be diabetes, hypertension, high blood pressure, uh, by far. And those are,
Which goes with what I said to him. He's got kidney issues and he's a type 2 diabetic, right?
yes,
Exactly.
yeah. I mean, those are by far. There are a number of other things that can also contribute to. There can be autoimmune kidney diseases, of
Sure.
which there are a number of
Sure.
types. One of which my mom had,
IgA
which is IgA
nephropathy.
nephropathy,
Yeah.
which is actually it's a one of the worldwide, actually one of the most common. It's called most common glomerulonephritis, which is a type of autoimmune kidney disease where you get blood in the urine. And yeah, that's one of the most common ones worldwide, and no one knows exactly what causes it. Possibly some sort of viral trigger then creates an autoimmune process.
Well, and so with the IgA, it's interesting you say that, because that's actually something I've been coming across quite a bit. IgA nephropathy. IgA is obviously the number one form of the immune system, specifically in the gut microbiome.
Yeah,
So, there's a lot of clinics and medical literatures that say, "Hey, we don't know exactly why you get IgA nephropathy," but they're coming to certain conclusions of saying, "We think that it can have to do with infections, or, these different types of things." And that's immediately what I jump to, because
yeah,
if the IgA, I see it all the time on GI maps, it'll tell me where your IgA is.
yeah.
And if you have a gut infection, a lot of times your IgA is up, or sometimes it's super tanked, but either way, your immune system's through the roof. But if you're having a serious gut infection, which obviously is running rampant in the United States right now, and your immunoglobulin antibodies are going crazy trying to fight this infection, if you have an abundance of IgA running through the bloodstream because of a gut infection, couldn't abundant of those get lodged into the kidneys as it's filtering through your system, and then therefore that's what IgA nephropathy is too much IgA coming into the kidneys and causing that inflammation? Couldn't it be because of that gut issue?
Possibly. I mean, not now. I've done also a lot of GI map profiles of people with high secretory IgA. Now,
Yeah.
a lot of them don't necessarily get IgA nephropathy, but at the same time, IgA is something that's secreted by the gut, and there's something to be said about healing the gut as a first line intervention to see if you can uh, mitigate some of the uh,
Systemic
hematuria or
inflammation.
proteinuria
Yeah.
because the kidney damage is ongoing. I'll tell you a story I had
Yeah.
years ago with a patient. This was he had stage 4 kidney disease, IgA nephropathy. He was and proteinuria is basically protein spilling the urine because you're having ongoing damage to the kidney. More protein you're spilling, more damage to kidneys it's reflecting that. And before he saw his conventional nephrologist, he wanted to see if there are other ways he can mitigate this. And so I started telling him about for leaky gut and elimination diet. Uh, Particularly, people may have intolerance to gluten, dairy,
Sure.
toxic things, and gut healing, probiotics, high dose omegas,
Yeah.
all those type of things, and put him on this regimen. And within a few months, his proteinuria decreased by 70%. His blood pressure normalized without adding any blood pressure medications.
Mm.
And this is before he saw the nephrologist. Saw the nephrologist and put him on some medications, and it improved some more. But just changing the diet,
Yeah,
fixing the
fixing
diet.
the gut.
That itself improved the
Kidney.
proteinuria
Yeah.
and the ongoing damage. And so that got me to thinking, and this has not been actively studied, but you know, what if you did a gut healing protocol first for these patients with IgA nephropathy, uh, um, and see how they would do? Because I'll tell you what traditionally you do is, immunosuppressants,
Which
steroids, all this type of stuff. And one of the immunosuppressants that's been done, they used to use steroids back in the day, right?
yeah.
Now they found that rather than doing steroids systemically, they have a version of steroids that is at the gut level. And it's interesting, is that it's just in the gut level.
Yeah.
And that is one of the common medications for that. And but it just goes to show that the issue, the origin of this is at the gut level.
Well, the reason this was actually the second thing I talked earlier about the difference between you and the other, nephrologist was the rapamycin thing, the way y'all responded. But this was the second thing, was I told you the first time I met you that in that meeting with the other nephrologist, I specifically, when he brought up IgA nephropathy, I had said my theory. I said, listen, science doesn't really know why you get IgA nephropathy, but IgA is the number one thing and I explained the gut microbiome and the immune system and all of that, and how IgA is specifically gut microbiome based. And he goes, no. IgA nephropathy and IgA have nothing to do with the gut microbiome. And that literally was what made me just go, we really have no reason to continue our conversations anymore. It was unbelievable. I was like, what do you mean it has nothing to do? It's literally the first line of defense of the gut microbiome.
Yeah.
So,
I mean, if that were the case, then why the one of the medications we use, a steroid, is gut specific?
Yeah.
I mean,
right.
that's and so
100%.
There's something to it. It would merit further study, but you'd have to integrate the academic nephrologist with functional medicine folks, to be able to combine that. And that's something that down the road I hope to help and
be able to bridge.
Yeah.
Well, let me ask you this. So we talked about the diabetes, which not just diabetes, but high blood sugar in general. So pre-diabetes or getting close to that whole context brings stress on the kidneys and everything else. Which by the way, one thing I've noticed in my practice is a lot of the people, because I was a pre-diabetic. When I had gut issues, I was so inflamed. My IgA was all the way high. I was so inflamed that my cells became insulin resistant. And my A1C, my blood sugar went up. But whenever that fixed, my A1C just dropped back down to perfect. 5.2, 5.3. And one of the things that I've noticed that when people come to me with kidney issues, I always notice in their blood work they have other inflammatory markers. And I go, we can't even fix the insulin issue. Sure, we can eat better and everything, but you have a root cause of inflammation, like a well springing in your body, that's causing you to be super insulin resistant, raising your blood sugar, and then therefore it's pressuring the kidneys. So you've got to fix, the inflammation issue. But the second reason you had said was blood pressure.
Yes.
I want you to talk about, is that just high blood pressure, or can low blood pressure do that too?
Well, both, although high blood pressure in a chronic scenario, low blood pressure in an acute scenario where they're having sepsis, which is a severe infection.
My mom had sepsis.
And their blood pressure crashes and they're in shock. And that can cause an acute kidney injury, because in that case you're not getting good blood flow to the kidneys.
So what are the main reasons for high blood pressure? And then I just recently had somebody come to me with low blood pressure. What are the top reasons for high blood pressure, and what are the top reasons for low blood pressure?
Okay, so high blood pressure, they're multifactorial. One of the things is excessive salt. Another, excessive weight. Excessive stress. Sleep problems, poor sleep apnea. Which is on my pillars of my algorithm of 6. Poor sleep can lead to high blood pressure and insulin resistance, leading to diabetes. And so, and of course there can be some genetic predisposition too. But a lot of people, at least conventional doctors, I remember once to a lecture with one well-known conventional doctor in the city, he said, everything is just genetic. Either you got the good genes or you don't. Like, that's not true.
No, it's
a lot of things is epigenetic. In other words, you may have some genetic
predispositions, but it doesn't mean you have to have it.
But whether you express it or not depends on whether you've optimized that algorithm of 6 or not.
It's like the the thyroid peroxidase I just explained to myself. I've never had that show before, but the great stress and incredible amounts of gluten I had
Yeah.
over the last couple of weeks, it caused that to express. And so that's why I literally actually reached out to my parents and I said, hey, I think we actually have a genetic predisposition in our family to potentially thyroid, hypothyroid. And then my dad started talking about, hey, your mom, this, that, and the other. And I go, okay, so we do have some genetic disposition to that. So I can go back to where that doesn't ever express itself again. Because like I said, I've never had it express itself before.
Yeah.
But the two lifestyle things that happened was adding gluten and the crazy amounts of stress I've had since my uncle passed.
Yeah.
That expressed that. It's like when people talk about genetics, I talk about how, in your home, you can have like on one wall, like 7 light switches. The light switches came with the home, but you get to choose which lights you want to turn on. It's the same thing with genes. The genes came with your body, but you get to choose through lifestyle which genes you really want to turn on. That will never be the reason for our sickness. If it is, it's a lazy, easy cop-out excuse.
Yeah.
So go into, so you talked about the high. What are the top reasons for low blood pressure? I feel like that's more of a little less known in the common generational world.
Yeah. So I mean, now, low blood pressure looks to the point where it's causing a kidney issue, kidney failure. I mean, it's usually going to be in the context of some sort of shock. Most common is sepsis, which is basically infection.
Yep.
But you could have other forms of shocks. Maybe you have like a major traumatic injury with blood loss, and then all of a sudden you go into like hemorrhagic shock. Right?
What if it's not to the point of kidney? It's just, hey, I just struggle with low blood pressure. What is usually in that regard?
Well, that some people do have issues with low blood pressure. That could be a number of things. Usually, though, it's when the people are saying that and they're still talking to you, their blood pressure is more like the top number is like in the 90s or something, right? And so that's probably not going to cause that's kidney failure.
Whereas you want it like what, between under 130 on the top, and what do you want the low number?
And yeah, so the top you want to be under 130, and the bottom you want to be under 80.
Yeah.
And of course, low blood pressure, it can usually the top number is below 90, and the bottom number is below 60.
Whereas you just want it below 80, you don't want it that low, below 60.
Yeah, so you say me, so basically somewhere, usually if you're between 100 and 120 for your top number, that's ideal.
Okay.
And so, but yeah, that's what it is about. It's all about balance in life, right?
Yeah.
An extreme of one.
That's what you've really been teaching me, is balance. Because I've gotten to be. I'm thankful that I've gotten to learn as much as I have, just because I have a passion for it. So I don't have to learn what you have to study in the medical field, which could be great or it could be not so great or whatever. But at the end of the day, learning that balance has been really critical for me, bringing things back into the world. I come from the bodybuilding world initially, not lately, but starting 10 years ago, 12 years ago, right? And that's a very extreme measure of things with testosterone, things with supplements, things with working out, things with nutrition, and so forth. There is no moderation at all in that. So I've had a lot of things to like hone back in on and tone back and everything else, which I'm really thankful that you've kind of been able to bring those different insights on. But no, like I said, we've talked many times about how I had somebody actually in the functional space. This person is one of the owners of a clinic, a functional clinic, one of the biggest supplement companies in the functional space. And this individual told me, hey, Nick, which they have a rapid growing functional practice. So they probably have more connections than I do in this space. And she said, when she heard about you and everything, she said, Nick, you might actually be the first functional nutrition practice in the country, or the one that we know of, that actually has an MD fully in their practice as a consultant. They said, we've been literally looking for that for years, but we have not been able to find somebody that is open-minded in the functional space and that specializes in getting people off medication, like doing everything that you really, like me and you have talked about. And they said it's all the typical conventional concepts, and they go, we don't need that, we don't want that, we don't believe in that. So, I think that this is awesome because we are focusing on getting people off of things. We are focusing on dealing with root causes. But, one of the examples I was just giving the other day was when that, and we'll kind of, put a bow on it with this one, but just a crazy example. We've talked about Parkinson's and, some of the different things that my clients were facing, where there was one of the things where I go, hey, you know what, I need Vic's opinion on this, But One of the things that really hit me the other day was a woman I knew from the bodybuilding space over 10 years ago, or about 10 years ago. This woman was a shredded 115, 115 pounds. And that's soaking wet. This girl has no body fat on her, to where if she would have dropped down to 113 pounds, like, where is that weight going to come off of? You're totally peeled. Well, she reaches out to me for the first time in a long time. She's been watching all my stuff as a pastor and kind of keeps up with that. And she said to me, she said, Nick, I really need your help. I need to get into your practice and this, that, and the other. And I said, what's going on? She said, the doctors don't know what to do with me. They want to admit me. I've lost 30 pounds in 12 weeks and I can barely hold 80 pounds. And they said, they're scared that I'm not going to wake up tomorrow. And so when she started sharing with me these different things, in my mind, what's racing through my mind is, this sounds like an insulin issue. Like, no matter how much she eats, she's dropping weight. And I go, I feel like she's somehow secreting too much insulin from the pancreas. I was like, maybe she has a little bit of inflammation and it's causing the, too much this, that, and the other. So I remember I brought this to you and I said, hey, what's your thought on this? And you had brought up insulinoma. And insulinoma being a tumor noma just being a tumor that can secrete any hormone, this one specifically being secreting insulin. Hey, you need to go to an endocrinologist. Well, before me, she's gone from doctor to doctor to doctor to doctor to doctor to doctor, paying all this money. None of them can help anything. And so now she just came to me with that, and now she gets an easy answer. Hey, this is what you need to look into. This is what's going on. Go see this endocrinologist. You need to get the tumor removed. And so having that type of backing, with my practice and with me to be able to just, reach out and have those different things, not only is it so amazing for me, but I've had multiple clients over the last couple of weeks since me and you really started bringing this about, where that makes them feel phenomenal. And now that I'm offering a functional mentor, I'm offering a functional mentorship. Me and my business coach just launched that over the last 2 weeks. I have multiple coaches around the country. I just signed one up in Tennessee last night, where they have a clientele, they have their own practice, but they're coming under me to learn and to study these different cases. And so I've told them about you, and I said, so listen, if there's something I don't know, I got somebody else who does, and this, that, and the other. That makes them want to come and study within my practice even more. Because like I said, that woman who is part of one of the fastest growing functional companies in the country said, you might be the first one to actually do this. And I was like, hey, I'd be surprised if I was, but I wouldn't be surprised if I also wouldn't be surprised if I, was whatever. So this has been a huge blessing for me so far. I know it's probably been a good blessing for you, and hopefully entering you into a space that I think that you'll really be able to shine a lot of light in and everything else. But I think it's positive for everybody all the way around.
Yes, I agree. It's a great thing. God puts people together for a reason.
Amen.
And especially, when I first met you in one of the freestanding yards I work, which is one of the busiest ones in that system that I work at. So it's rare to even have time to even talk, but somehow we managed to have time to talk for like half an hour to an hour.
Right.
Periodically while we were there, and get to a point where it's like, where I didn't realize you were in the functional space, but you were talking about things like, it's like, are you into this? And then you didn't realize that I was in it.
Right.
And all of a sudden we come together here.
Integrating.
Integrative. That's what
there
it's all about.
Right.
So.
That's awesome. Well, thank you so much, Dr. Wajan. I really hope that this episode blesses people. And for all of you listeners out there, if you have any questions, please feel free to email me at lifestyleofeden@gmail.com. I hope that this episode is a blessing to you. I hope it brings a little bit of perspective to get environment, cleansed out, to get stress removed from your life, to get community, to focus on your relationships, and to realize how these things are affecting you. And also, I hope that it sheds a little bit of light on your kidneys, on blood work, and just the functional space and what we're doing specifically in my practice in order to best serve you and help you guys. So stay tuned for the next episode.